Hi, my name is Svendsen. I'm a dermatologist at the Department of Dermatology and Allergy Center at Odense University Hospital in Denmark. This study was conducted because topical antipsoriatic drugs are recommended first-line treatment for mild to moderate psoriasis, but the reported real-life use is conflicting. We conducted a nationwide drug utilization study by extracting data from the Danish health registries. We obtained data from patients above 18 years of age who consulted with a psoriasis diagnosis at a Danish hospital dermatology clinic and who had redeemed a prescription for at least one topical antipsoriatic drug in the period 2005 to 2015. During the study period, almost 8,000 Danish psoriasis patients had redeemed their prescription for at least one topical antipsoriatic drug. 26% of the study population had at least one psoriasis-associated comorbidity, the most frequent comorbidities being hypertension and depression or anxiety. 3/4 of the study population only used topical antipsoriatic drugs to treat psoriasis. The most frequently used topical antipsoriatic drug was corticosteroids with calcipotriol. And during the study period, there was a 19% reduction in the total use of topical antipsoriatic drugs. On this graph, the y-axis represents the proportion of patients who in the last 180 days have redeemed a prescription for a topical antipsoriatic drug in relation to time of psoriasis diagnosis, which is set at year 0 on the x-axis. The graph shows that the use of topical antipsoriatic drugs increased around time of psoriasis diagnosis and then during a following 3-year period dropped to the same level of use as before diagnosis. There were considerable differences in use of topical antipsoriatic drugs between geographical regions, with up to 89% variation in use of moderate corticosteroids. Dermatologists need to be aware that many psoriasis patients suffer from one or more psoriasis-associated comorbidities. In conclusion, the use of topical antipsoriatic drugs shows considerable heterogeneity over time, as well as regional practices and differences between patients. Thank you.